So the patient comes into the hospital and you do your history and physical the first day, and now the patient's here on day 2, 3, day 4, and now you're going to do a progress note. Progress notes are also incredibly important because the progress note is the snapshot of the patient each day. And when you put the first day together with the second and the third and the fourth day, when you put together those notes, it's like frames in a movie. And you want to really see the episode of care and how it flows. So the progress note, similarly to the history and physical, but unlike the history and physical, the progress note is much simpler, not as involved because you have that history and physical already done. But there's a few components of the progress note that are critically important. All the elements are important, but I'm going to talk about 2 specifically. So first, the progress note, we call them the SOAP note. S is for subjective, O is for objective, and A and P is for assessment plan. So it's the SOAP note. Now, one area of the progress note that's not done well by physicians is the subjective. The subjective is supposed to be how the patient is doing that day overall, and also specifically about their complaints. And it's supposed to be in the patient's own words. So when you go to Mr. Jones or Mrs. Smith, how are you doing today? I'm doing much better. How are you doing today? I'm not really doing so well. How's your chest pain? Well, it's better. How's your abdominal pain? Well, it's better. How's your abdominal pain? Well, it's worse today. So the subjective is critically important. It's important to know how the patient's doing. Again, how is their main symptom doing? How are they doing overall? And also, you probably want to ask about all the different kinds of symptoms because that's what guides your care. Now, the objective is the vital signs, the lab tests, your physical exam, and that's important as well. But then the other critical component is the assessment plan. And just like in the history and physical, the assessment plan has to be done in a problem-oriented fashion. You should list every problem and make a comment on that problem. Is it getting better? Is it getting worse? What are you going to do? Even insignificant problems, you should list it and you can just say, not a problem today, or resolved. But it's really important to do the SOAP note, do the progress note in a high-quality way because, again, when people read your note, they can see what you're thinking, why you're thinking it. They can see how the patient's doing. And I'd suggest another part of the SOAP note, which is, when's the patient going home? When do you expect them to go home? Where are they going to go to? Because again, if you can put this in your note, it kind of alerts the whole team that the patient's ready to go home tomorrow. It alerts the whole team that the patient might need to have a nebulizer set up when they go home and they might need home health. So again, it's a good tool to use for transitions in care. So again, history and physical, very important. Progress notes, very important. And now we're going to talk a little bit about the discharge summary, which is also very important.